let's shift gear to talk about CRPC. And there's a recent presentation in asthma meeting 2024. There's a study called PEACE-3. Have you heard about the study? Go ahead.
Did you refresh my memory? Is that with the Radium-223?
Right.
And ARPI?
Yep.
Yeah.
Mm-hmm.
Yep.
Yeah.
So, Alex, you want to?
Yeah, basically this was a study looking at whether the use of Radium-223 with enzalutamide would improve outcomes versus enzalutamide alone in patients who had previously, in the castration-sensitive setting, only been on ADT. And there was a significant radiographic progression-free survival benefit with the addition of Radium-223 to enzalutamide in those patients.
And there's a trend favor overall survival. The data is now mature, but the difference between the two arms is fairly impressive. I would say the overall survival is close to 7 to 8 months. Even though statistically, from methodology standpoint, it's not mature yet, but it's a very, very interesting study. So, as you know, Radium-223 is the first radiopharmaceuticals approved that has been shown to improve overall survival based on the Simca trial back in 2013, 2014. And in recent years, our interest has shifted away from using radium because of another newer and shining radiopharmaceuticals, which is lutetium PSMA 617 or Pluvicto. And I'm sure everybody here, Dr. Raj, have you used?
Yeah, we have used lutetium also. I find the data intriguing and with radium and ARPI. But I'm just wondering if we expose radiation, radioligand treatment after this particular treatment, are we exposing patients for risk of other bone marrow disorders? That's a concern.
So, Dr. Raj, can we discuss a little bit the difference between the two radiopharmaceuticals, Radium-223 versus lutetium PSMA?
So I'm not so well versed with the physics of it, but my understanding is that radioligand targets where the PSA is secreting cells and in the tumor cells, and the radium and such things, what I think of is they have affinity for the bone metastatic lesions. But I'm not sure exactly what radiation is given by what.
Right. So Radium-223 is in the class of calcium, and it's the same class can be absorbed by the size of high bone turnover. So that's typically where bone metastasis locates. So this is a mechanism that's being utilized to target bone metastasis, and the Simca trial and 12 years ago, and has demonstrated in a castration-resistant setting using Radium-223 in patients with mostly bone-predominant disease. There's improvement in overall survival. And so the PEACE-3, I think, rekindled the interest of Radium-223 in the era of theranostics, and which means PSMA-based treatment, right? And everybody focused their, PSMA PET scan and PSMA targeting radiopharmaceuticals, lutetium PSMA. So, what do you think? The PEACE-3 trial showed very impressive survival data. The caveat is the population that never exposed to ARPI in the past. But the study, the study arm has the enzalutamide plus radium compared to enzalutamide alone. So it's not comparing ARPI, but simply by adding radium to the ARPI, there's a dramatic improvement in outcome. So what do you think? What is the chance in your practice to incorporate radium-223 in metastatic CRPC?
Find the right patient. It's just, I think most people, majority of patients have been exposed to an ARPI.
PEACE-3 show such impressive data, and granted, is in a very different population compared to the patient population that we see in North America. In what scenario would you consider using radium-223, and in what setting?
Oh, I think that would be the setting. If somebody was treated previously just ADT only, which is, it's not that common anymore. So it has to be a specific patient, right, who's a candidate. And then they did add like a bone modifying agent too because of the.
Right, so that's a very important point. That is very important point. There was one study done at the time when after the Helsinki trial, and that's at the time when the abiraterone was just approved. The idea was natural to combine these two, so that was the ERA-223 trial. And the trial ended up being a negative. In fact, the experimental arm actually did worse than the control arm. And so the lesson learned from that study is that the patient on ARPI abiraterone in that setting happened to have more bone skeletal related events. So because of that lesson in the PEACE-3 trial, it is mandate for everyone to receive bone modifying agent. Denosumab for zoledronic acid.
So how often did they give
So-
it in the study? Like, did they give it monthly or?
Well, that's a very important question, right? So how to use bone modifying agent. In the PEACE-3 trial, I don't recall how it is given. In practice, the FDA indication for denosumab or zoledronic acid in the CRPC setting, the label is monthly.
Monthly.
But in practice, we know that every 2 months or every quarterly use of bone modifying agents is pretty much equivalent.
Specifically, not for denosumab.
I thought there was updated data. You could go to every 3 months after a period of time when they were on monthly.
But not with denosumab, you're saying, just, okay.
Right. So that's very important point you brought up. Bone modifying agents is crucial as a part of the regimen when you offer radium-223 plus any ARPI. And so now let's talk about sequencing issue. And we have all the upfront treatment, triplet or doublet or ARPI. When you see a patient with CRPC, what's your thought? What's your first move when someone develops CRPC?
Well, I think today most of the patients who are developing the castrate-resistant disease still likely only had ADT, or they didn't have doublet or triplet therapy up front because it's still so fairly new. But I think this is going to be a big problem in several years from now, when a lot of these patients, even in the high-risk setting, were receiving it, right after their initial treatment, and now we've kind of used up a lot of our medications whenever they've become castrate-resistant. So I think this is going to be a very big future problem that we're going to face.
Radioligand therapy be the option once you exhaust all those things.